Friends from near and afar, I'd like to extend the warmest welcome to all of you to the online Golden Age Expo and Summit. Due to restrictions in international travel, this annual event has gone hybrid for the third year. This year, we will have 2 days of virtual event from July the 29th to the 30th, followed by the physical event to be held in Hong Kong from August the 5th to the 7th. We are currently in the middle of 3 unprecedented crises: a pandemic, an economic downturn, and changes in social and demographic structures. It is high time for all of us to seize this moment to learn from the crises that we have been facing and take changes that matter. Such challenges cannot be addressed by governments, business, or NGOs alone. We must bounce forward together with cross-sectoral collaborations. In light of this, the 7th Golden Age Expo and Summit will focus on innovation, sustainability, and inclusion for building a smart aging society. We see each crisis as an opportunity for innovation, adapting to the shifting needs of the aging population. The pandemic has shown that it is essential to innovate our healthcare, medical, elderly care, and social systems. It is the same for the private sector. The need for innovation has never been greater as businesses have tried to respond to changing consumer needs necessitated by the pandemic. Population aging is a universal phenomenon appearing for the first time in human history. Sustainability can increase life expectancy by providing healthier living conditions and better health and social care, which could also lessen the divide between the rich and the poor. Many Asian cities, for example Hong Kong, have been highly developed, but there are huge social challenges such as poverty, climate change, cross-generational issues. It is necessary to enter a circular economy by making full use of existing resources and continuously revitalizing the community. Along with natural resources, sustainability also requires financial and social sustainability. When we think about innovative solutions and sustainable developments, we should start from the perspective of inclusion, of the well-being of people of all ages by creating a more inclusive economy, encouraging personal responsibility while providing support for those in need, making sure that no one will be left behind in the post-pandemic recovery. We need you, innovators with new solutions, entrepreneurs with products and services that fill the market needs, investors and funders that can take the best ideas to scale, and policymakers to support a more collaborative ecosystem. This is our challenge, and this is also your opportunity to build better solutions for our aging society and our planet. We all need to work together in partnerships. During the 2-day virtual program, global and regional speakers will look into the resonant theme of innovation, sustainability, and inclusion, offering opportunities for improving practices, deepening impact, and building transformative partnerships for a smart aging society. Last but certainly not the least, my heartfelt gratitude to our partners, sponsors, and supporting organizations for making the online and physical events possible, and to our speakers and facilitators for the rich diversity of perspectives and experiences to be shared during the entire Golden Age Expo and Summit. From a distance, I wish you a most fruitful and enjoyable participation. Take care till we meet again. Thank you.
Good morning, ladies and gentlemen. Greetings from the Population Division of the United Nations in New York. I'm very grateful to the organizers of the symposium, the Golden Age Foundation, for this opportunity to address you at the opening of the summit titled Smart Aging, Sustainability and Inclusion. Let me start off this address with a positive note. Population aging is a human success story that results from the advancement of public health, economic and social development, and their contribution to reducing both fertility rates and premature death. People are living longer lives, and both the share and the number of older persons in the total population are growing rapidly. Globally, there were 727 million persons aged 65 years or over in 2020. And over the next 3 decades, the number of older persons worldwide is projected to more than double, reaching over 1.5 billion in 2050. We know that on average, women live longer than men. Therefore, they comprise the majority of older persons, especially at advanced ages. A newborn in China, Hong Kong as they are today, can expect to live 85 years and almost 90 years in 2050. And an older person celebrating his or her 65th birthday today can foresee to live another 23 years. And an octogenarian today can expect to be around for another 11 years. While population aging presents many challenges, it also offers unprecedented opportunities to all of us, governments, the private sector, civil society, academia, and individuals. We at the United Nations call particularly on governments to ensure that aging and old age concerns are integrated in all policy areas at the national and international levels. We also encourage governments to consult with older persons and their representatives in planning and decision-making processes to reflect their diverse needs. Ageism and age discrimination need to be addressed, and governments are called to provide social protection systems as well as adequate employment opportunities to maintain economic security. People-centered care and support systems for older persons are critical for the enjoyment of the right of older persons to autonomy and independence. Governments need to take the lead and to engage with the private sector, civil society, and older persons themselves to take advantage of the new opportunities aging presents. Older workers have proven that they matter, and they matter in terms of GDP. Many older workers wish to stay in employment for financial reasons, but also for personal fulfillment. And many companies in rapidly aging countries or areas in Asia, particularly in Japan, South Korea, and in China, Hong Kong as they are, but also in Europe and the Americas, recognize the need to keep older workers employed to maintain productivity and growth. An OECD study shows that building multi-generational workforces, offering flexible working conditions, and addressing negative stereotyping against older workers, along with reducing age biases in recruitment, could raise GDP per capita by 19% over the next decades. The Living, Learning, and Earning Longer initiative, a joint effort of the American Association of Retired Persons, the OECD, and the World Economic Forum, makes the business case for creating and investing in a multi-generational workforce. More than 50 global employers, representing over 2 million employees and $1 trillion in annual revenue, showcase the positive impact of age diversity and inclusion on the economy, businesses, and employees. Governments need to engage particularly with the private sector, but also with older persons themselves to establish the necessary legal and policy frameworks to allow all older persons, including those in less good health, to remain employed or to seek new employment if they so desire. Another opportunity for governments to support aging societies is to provide opportunities to take advantage of the digital transformation by ensuring access to sustained training and skills upgrade throughout the lifespan. E-learning and online learning platforms provide access to a wide range of academic and other training materials. Affordable and accessible technologies allow people to work remotely and to enhance people's employment and training opportunities considerably. However, we need to be mindful that the wide range of online training programs available make it difficult to identify reputable and certified offers. Employment in the platform economy bears innate risks, since it often offers irregular and unregulated employment, and many times this employment comes without social or health benefits. To ensure that lack of education or financial resources do not exclude marginalized groups from benefiting from the digital transformation, special efforts need to be undertaken to ensure that these opportunities are also available and accessible to the most disadvantaged groups of society, often older women with less education and limited financial resources. This leads me to my third point. Cities offer opportunities for aging in place, and government support is needed to set up infrastructure and support systems. Growing old at home or aging in place is a central desire for the majority of older women and men all over the world. And this is also the case for older persons in China, Hong Kong, SAR. A recent survey conducted by the organizers of this event found that almost 50% of older persons do have a plan to support their desire to age in place. Cities offer a wide range of choices regarding housing and living arrangements that allow for aging in place and that cater to the individual health and social needs and economic means of older persons. Digital inclusion and smart city technologies can provide older persons with independence and a more comfortable environment to live in, and robots and smartphone apps offer the convenience of virtual grocery shopping and delivery, as well as medical consultations and on-demand transportation at an individual fingertip. Aging in place is of critical importance for the growing number of older persons who live with dementia. Worldwide, around 50 million people have dementia, and every year there are nearly 10 million new cases. While many city administrations undertake considerable efforts to provide an adequate infrastructure to accommodate the needs of older persons, realizing the desire to live and age in place requires a well-established network of formal and informal care providers. Governments need to recognize the value of care, the formal and the informal care. And national ministries, local governments, and service providers need to collaborate and to explore innovative, affordable, accessible, and people-centered community-based service models to support aging in place for all. And finally, the COVID-19 pandemic provides many opportunities to build back better societies for all. The COVID-19 pandemic has brought the world to an unprecedented halt. It has exposed underlying inequalities and has shown more clearly how they affect the most vulnerable among those many older persons. But the pandemic can also be viewed as a stress test, measuring how prepared countries are for aging societies. It has highlighted the gravity and urgency of the situation for older persons, many of whom have faced specific and differentiated challenges, amplified by existing structures of inequality and disadvantage that are often deeply rooted in ageism. The pandemic has also provided ample opportunities for older persons to show their resilience and to demonstrate their agility and ability to contribute in times of need. We know that the pandemic can drive change, and we have seen that in the face of these tremendous challenges, governments, the private sector, academia, and the United Nations system have shown enormous resilience and have demonstrated remarkable creativity and new forms of collaboration. Building forward better demands from governments and key stakeholders and acceptance that a growing number of older persons can no longer be ignored or seen as idle recipients of welfare or social support. They must be an integral part of their societies. They must be active in work to the extent they can and want to, and be engaged in all aspects of life, in their families, communities, and countries. We at the United Nations believe that the Madrid International Plan of Action on Aging, as well as the Sustainable Development Goals adopted as part of the 2030 Sustainable Development Agenda in 2015 by the world leaders, provide the roadmap to recovery. The world right now is at a critical juncture in human history, and the decisions we make and the actions we take today will have momentous consequences for future generations. Let me conclude by wishing you interesting and fruitful discussions and deliberations over the next days, and I do hope to be able to join you in person at the 2023 summit. I thank you for your attention.
Hello, I'm Karen EGGLESTON from Stanford University, and I'm delighted to be with you today, if only virtually. I wish I could be there in person, and I'm truly honored to be asked to share with you some of my research related to healthy aging, joint with colleagues in Asia. So I wanted to first thank the organizers of the 7th Golden Age Expo and Summit, and share with you a little bit of research I've done with colleagues on the question of innovation for healthy aging, perspectives from health economics research. This nexus of health and aging with technology and innovation is very important for all of our lives, and I think a lot can be learned if we generate evidence to inform policy and individual and community decisions to work together to promote healthy aging. First, some of the demography. As you know, East Asia is, in a sense, leading the world in terms of the new demographic transition, or the fact that most gains in life expectancy are now realized late in life. Jointly with esteemed colleague Victor Fuchs, we had called this new demographic transition and showed how the share of increases in life expectancy that are realized late in life has increased over a century, and in some senses approaching 100% asymptotically, which means that increasingly the increases in our health and longevity are coming late in life in the traditional retirement years as we conquer infant mortality and bring down midlife mortality, except perhaps here in the US, unfortunately. And with these longer lives, we need to promote longer working lives and social engagement, and not just think that age 65 means you've turned old, as you all know. So what does that look like pictorially? Here's the share of gains in life expectancy at birth realized after age 65 over a century, and with the current now high-income countries. At first, it was low because of high infant child mortality, and now it's getting to be quite high. And in the most recent 20-year period, continues to be over 80% on average. Japan still 84%. So a lot of these increases in health are accruing late in life, and we really need to think about healthy aging, staying engaged longer, and how we can work with civil society organizations to enjoy what we may call this triumph of longevity. So will longer lives be healthy lives? Smart cities hopefully can promote that, because we know population aging and healthcare spending growth are challenging universal healthcare coverage sustainability, as well as other programs, pensions, and other support. So policymakers in general are searching for strategies that include several: how to improve health through prevention, maybe require annual health screenings as in Japan, or have subsidized ones every other year like South Korea, enhance healthcare productivity or value for money in managing chronic diseases, encourage or nudge patients to seek care in the most cost-effective settings, address inequalities and support caregiving, I thought I'd share with you just snippets of research I've done with aging colleagues on each of these 5 topics. So working with colleagues from the University of Tokyo, we looked at Japan's policy of requiring a health checkup every year for adults. And we look at this in terms sort of the efficiency of sending a signal to adults. You had your checkup, here you're on the borderline of having pre-diabetes or diabetes, and encouraging individuals to do something about that. Does that lead to better health a year or 2 later? We find that people do go to the doctor more often, but health outcomes do not appear to improve in general a year or 2 later. For the general population, although those that are high risk really needed that extra utilization, and it's worth it in terms of better health outcomes. What that means that these health checkups can improve well-being if the thresholds for saying when you need to go to the doctor or be labeled with a disease are set appropriately, and that follow-up care is well targeted. I won't go through the details, but it is supported by econometric analysis, regression discontinuity, you can see here, or read the article if you're interested. More importantly for policy, as I think we all know in our everyday lives, behavioral change for healthy aging, eating a healthy diet, always exercising, quitting smoking, being engaged, it can be difficult if you have other habits. And health screening, unfortunately, is not a panacea, although it can help if the clinical thresholds are set appropriate and other design features think about the cost effectiveness as well as promoting value for money, targeting on those that would be at highest risk if they did not have these checkups. Also, in working with Japanese colleagues, we developed a simulation of the future elderly. And an important take home here is that better education and other improvements in the social determinants of health, not medical care, can be extremely important and lead to healthier, longer lives. And this is very important for smart cities to promote investments in taking care of ourselves, human capital, as we health economists would call it. In particular for Japan, we found that because the future elderly will be much better educated than the current elderly, that they will enjoy healthier, longer lives, and projected prevalence of frailty and dementia is lower than they otherwise would be because of this greater education. We also looked at the quality of care as well as cost spending increases in 4 different health systems in one particular study, working with colleagues there in Hong Kong. We looked at this question about improving value, not just controlling costs, because improvements in medical treatment have contributed to rising health spending, but there's little evidence on whether the spending is worth it in the sense of improving the quality of our lives of commensurate value. So without such evidence, trying to control medical spending growth might stifle valuable innovation as much as waste and inefficiency, which is what we're trying to address. So in this study, we analyzed individual patient level data on over 100,000 patients with type 2 diabetes in 4 health systems of Japan, the Netherlands, Hong Kong, and Taiwan. We used a cost of living method. I won't go into the details, but we find that the value of improved survival from diabetes management outweighs the increased cost of care in each of these 4 systems. And this is robust to accounting for many other things, including that part of the survival improvement comes from people's own healthy choices, not necessarily medical care. So that suggests we can invest in better productivity of our health systems. We also need to address disparities. Here's one measure of healthcare access and quality index and how it varies across many health systems in the world. And I have plotted China, dividing it out into proxies for urban and rural China, just to show that there are great disparities even within countries, particularly large and diverse ones like China. As you know, rural Guizhou is not the same as Hong Kong. And perhaps unsurprisingly, when you break it out that way, you find that urban China is close in access and quality to South Korea or the US or other high-income countries, whereas rural China is closer to Vietnam or lagging a little behind Brazil. So we need to think about healthy aging, both for those who are already privileged and those who might otherwise be left behind. To quote Dr. Martin Luther King Jr., of all the forms of inequality, injustice in health is the most shocking and the most inhuman. So hopefully we can work together with civil society to address some of these disparities. I worked with some colleagues in the Zhejiang Provincial CDC to look at one of their programs in rural parts of the province, and indeed in other parts of China, that try to manage individuals with hypertension or diabetes close to home in their villages, and looking at management programs for hypertension and diabetes. And we found some encouraging evidence because the places that were most intensively managed had more visits to primary care and fewer specialist visits going to the county hospital, for example, and fewer avoidable admissions to hospitals, which led to overall lower medical spending and better health, especially better control of blood pressure. So in this case, if we know what works, investing money in that can help save money as well as improve lives. But we have to get the evidence to know about what works to help close disparities. And in that respect, we need to work together, public and private and community and individuals together, what we have called with colleagues collaborative governance. We could potentially leverage new technologies for closing health disparities, improving overall health, restore trends in healthy aging that we had before the pandemic, and innovate to build more resilient health systems. But of course, this requires careful regulation and transparency. If anyone's curious, I have a book looking at the dragon, the eagle, and the private sector on public-private collaboration in China and the US, as well as a documentary. If you search YouTube for proper scope of government, you can see one of the economic foundations for thinking about this role of the government and look at the sections on health policy or the COVID-19 pandemic. In our book, we talk about the importance of careful design of policy, leveraging private sector actors to work together with the government towards common goals, and then having a feedback loop where we generate evidence to really find out what works. Finally, can we leverage technology and collaborative governance to improve productivity in long-term care for some of our most vulnerable and frail citizens? In collaboration with colleagues at the University of Tokyo and Notre Dame, we looked at robots and labor in nursing homes in Japan. Looking at Japan in particular, using variation because across prefectures in Japan, there are subsidized for nursing homes to adopt robots. And we use this to look at the effect of a nursing home adopting a robot in their caregiving to supplement their caregiving workforce and care for the elderly. And we find that adopting robots appears to decrease the difficulty in staff retention at nursing homes, which can be important for providing continuous quality care. And it actually leads to increased employment, not decreased employment, by augmenting the number of care workers and nurses on flexible employment contracts. Of course, monthly wages may or may not have gone down. It might be because they are less burdened with night shifts, but we're looking into that in more detail. In any case, we also find robots are associated with higher nurse staffing per resident, controlling for resident case mix, which hints that appropriate use of technology might support our caregiving staff and improve health and quality of care, although that needs to be followed more generally. So robots may supplement the caregiving economy without being detrimental to the workforce if adopted appropriately in societies with rapidly aging populations. And other technologies could be leveraged in this way if we generate the evidence to know what works. If you want to learn more, you can listen to the Freakonomics podcast about this. Or look at our website at the Stanford Asia Health Policy Program to know about other research that we're doing and our webinar series on these and other topics. Here are some of the books that has the research with colleagues that I've talked about, I would thank you very much for your attention and for the honor of speaking with you today. 谢谢, and best wishes for a wonderful expo.
Hello, and thank you very much for inviting me to your 7th Golden Age Expo and Summit. And I'm really pleased to be with you in the room virtually today. And my name is Dr. Adrian Hayter, and I'm a GP who works in Windsor and the National Clinical Director for Older People and Integrated Person-Centred Care at NHS England. And I'm really pleased to be joining you today from the British Geriatric Society, where they've just held their 2022 Frailty and Urgent Care meeting. So the NHS has just celebrated its 74th birthday, and this is a new chapter in the NHS where we have changed our system way of working towards developing integrated care systems. And this is the second week of those integrated care systems being devolved throughout the country. We've got 42 systems which are joining both the health and the care being delivered to their populations ranging from 800,000 to a few million population. And those populations are managing and supporting older people. So this has brought about a new way in the way that we're thinking about care and bringing into account innovation, sustainability and inclusion into that agenda. Older people, as they age, in any society, need that more holistic support, that support which is delivered not by one agency, but by agencies working together. And the hope is we're going to build more resilient communities. Already I've gone out to visit a couple of integrated care systems, and I was with one the other day, and we looked at how they were looking at assessing older people using the WHO kind of initiative, the ICOPE, Integrated Care for Older People. And this is a way of looking at older people and supporting communities, not just professionals like GPs and geriatricians, to assess and support older people, but teaching communities how to do that. And we were in a leisure centre where they were using this way of working to be able to identify problems at an earlier stage and give a much more proactive response to some of the things that affect us while we're aging, things like our eyesight or our hearing. And it was great to see people from the leisure centre taking part in identifying problems at an earlier stage and supporting a networking approach to improve the care of those older people. So it really starts at that kind of ground level and what's happening in the community in Suffolk that I went to see. In England, like in many places, people use urgent care in hospitals, often at a later stage. And what we're trying to do is bring that to a much earlier stage through our Ageing Well programme. And that programme has 3 areas of concentration. One is a much more urgent response into people's own homes when they have a crisis, so that they don't get carried into a hospital setting and their needs are met in their own home place. And that happens within 2 hours, and we've rolled that out throughout the country. We also know that people living in care homes need better enhanced care. And so what we've done is we've supported those care homes with multidisciplinary teams and with a regular ward round or a check-in to support their care of those people who are most vulnerable in a care home, to stop them tipping into having to seek urgent care all the time in a hospital-based setting. And then the third programme, which we're launching later on this year, is anticipatory care, which is a proactive care and support plan for individuals, not just thinking about their health needs, but thinking about their social needs at a much earlier stage for people just living in the community who are vulnerable. And those are people often living with frailty or multiple long-term conditions. So those 3 programmes have been rolled out or being rolled out in England over the next few years. The second bit is that we're also bringing hospital into people's homes. So a hospital at home service, what we're calling a virtual ward service, is where people would have been treated in hospital for their acute exacerbation, their acute illness. And actually now what we're doing is we're bringing the hospital to them in their own homes. This gives less of a chance of them deconditioning in a hospital setting. People can be treated in familiar circumstances with all the equipment that's needed. Things like intravenous antibiotics, things like fluids, but also that their care can be monitored remotely by teams who are working to see how that person is responding to that treatment. And so the Virtual Ward programme is a new programme which we've launched in England with £500 million of investment over the next couple of years. So for older people in England, care is changing. We're using technology. We're also identifying people who are living in populations where we wouldn't normally reach them. And there's a programme which is looking at some of those health inequalities that occur not only in older people but in younger people as well. And we call that the Core 20+5, looking at people who live in the most deprived parts of our community and thinking about certain conditions that people live with as well. And that programme goes through all the work that we do in the NHS. So over the next 10 years or so, we're hoping that we're going to be able to build a better system of care, more joined up for older people living in our community. And I think in the world, we have the same problems. We have the same challenges with demography and the older person living longer. And so we all have to be thinking of the same solutions. But the key is knowing and understanding our communities, what's happening, what resources we've got within that community to support older people. And I'm hoping that during your summit that you're able to explore some of that and be able to learn, and hopefully we can learn from you around the things that are happening in your world. So thank you for inviting me to your conference to open your summit today. I'm really pleased to be here virtually, and I'm looking forward to hearing what you have to say. Thank you.
Greetings to everybody. This is Marvin Formosa, Director of the International Institute on Aging, United Nations Malta, and Professor of Gerontology at the University of Malta. Thank you for tuning in order to listen and participate actively in this Golden Age Expo and Summit, and I look forward to engaging with you today and even in the foreseeable future. I also need to congratulate the organizers for the efficient and smooth organization and running of this Golden Age Expo, which I'm sure will be instrumental for channeling and influencing global and international aging policy. This is a very important Golden Age Expo, precisely because I believe it touches on one of the pillars of contemporary society, smart aging. In our work at the United Nations, where we actually provide human capacity building for personnel working in the field of aging, but also visit and meet other persons who are in receipt of community care and long-term care, it is increasingly clear that smart aging is going to be a very important pillar of aging welfare, as far as informal care is concerned, as far as community care is concerned, and even long-term care. So, as much as education, specifically literacy, was important in the 1950s and 60s in order for people to reach a certain adequate level of citizenship, smart aging today is the gateway for actually living active, positive, successful, and even productive aging lifestyles. I'm saying this because smart aging now has found its way in our social networking, in our professional networking, and in our health networking. Active aging and healthy aging are very difficult to obtain unless one works outside the realm of, of smart aging. And of course, there are a number of challenges to reach this. We need to ensure, first of all, that both governments and non-governmental organizations pull in the same direction, that they encourage the adoption of digital competency skills amongst both personnel working with older persons and perhaps more challengingly, older persons themselves. At the same time, this transition, this turning point, whereby older persons become engaged in smart aging, needs also to ensure that older persons have the necessary hardware, have the necessary laptops, mobile phones, which work adequately. The third challenge, and here is where the United Nations and especially the International Institute on Aging is actually channeling much of its resources, is to enable older persons to learn digital literacy skills so as to become digitally competent. Of course, one cannot do this alone, and we need the assistance of the private sector. The private sector is currently investing a lot of energy, a lot of financial capital into aging welfare because, of course, there are a lot of opportunities. So aging provides both challenges and opportunities. And one particular opportunity is, of course, smart aging. Smart aging has the potential to result in a win-win situation for all stakeholders. And by stakeholders, I mean the private sector, the public sector, and older persons themselves. If we manage to work together, we should be able to improve the lives, the quality of life of older persons. We should be able to improve the revenue of the private sector, and the public sector can also achieve its goals. Precisely, the United Nations Sustainable Development Goals. So, the International Institute on Aging focuses a lot on the potential of learning in later life, because learning in later life has much potential in order to improve the levels of digital literacy and digital competencies amongst older persons. We are not content just to raise awareness, but it's very important for us that older persons themselves improve their skills. So smart aging is a journey. It's a journey from policy making, from advocacy at the public level, at the private level, but also it also refers to hard work on the ground, whereby older persons not only learn digitally skills, but also maintain and upkeep and even improve their skills. Because another challenging area in smart aging, and I hope that this is debated, is it's the rapidity of changes of updates, and of course, older persons needs to be also updated on such things. So learning is important. Learning should not be just the prerogative of the young, of children. Learning is a lifelong mission, and as Peter Jarvis says, living is learning, and learning is living. So, in my brief welcoming note, there's a lot to say, but time is limited. I think it's important for me to convey this message between how the importance of smart aging, the importance of older persons being digitally competent, and also the importance that we stakeholders enable older persons to be included. And in fact, I can see that one of the themes in the title of the Golden Expo is inclusion. And of course, that older persons are included in this digital revolution. This will, of course, enable win-win situations, just as I've said a few minutes ago. But most importantly, it will enable older persons to become or to maintain their full citizenship. To conclude, I really am excited about this Golden Age Expo because, of course, it is very rare that one finds expo focusing on older persons, and more so because it focuses on smart aging. As we are on the brink of 2023, smart aging is going to become the fulcrum of contemporary welfare services for older persons. Gone are the days when one used to queue up behind an office early in the morning. Nowadays, as you know, it's mostly everything is done virtually. I wish you a good debating period in this expo, and I am happy to join you during the period that the expo will take place. I wish you all the best. And should you think that the International Institute on Aging, United Nations Malta, can be of any assistance, please do not hesitate to contact us. We are, of course, at everybody's service. Thank you very much.